There are many pros to cardiorespiratory fitness and strength. One important factor to see results is to push yourself through the training. A pro to cardiorespiratory fitness is improving longevity. There's a clear correlation between cardiorespiratory fitness and longevity Pros of cardiorespiratory fitness is improving longevity. There's a clear correlation between consistent cardio exercise and having longevity within life. Anything even with a brisk walk for an hour a day increases that. Another example is reducing obesity. The more cardio and energy you use in a single workout, the more energy from the body fat is being used. This burns fat and eventually helps obesity. Another example is reducing hypertension. Reducing systolic pressure in the arteries, taking pressure off and making it easier to pump blood. This leads to less sudden deaths through heart attack and or stroke. Along with the importance of cardiorespiratory training, it is also important to strength train and help build muscles to better prepare for the future. A couple pros that can go along with strength training can include body shaping aspects. You can see this in bodybuilding a lot, where they will specifically build certain muscles to better fit the ideal standard. Another example is building strong bones, which helps later in life with osteoporosis, and it's just reducing the risk factor of breaking your bones. And then another example is the neuromuscular injury, is reducing the risk of a neuromuscular injury. So it's just strengthening your neck muscles and your back muscles. So if you get hit in the head, you're not a guaranteed fracture in your spine or your neck.
Although cardiorespiratory fitness and strength have pros that heavily outweigh the cons, there are limitations on these benefits. An excessive focus on cardiorespiratory fitness and strength can significantly impact the health of the human body's muscles, joints, ligaments, and pretty much all of those, just because it puts on extraneous stress on those joints and bones of fitness when you're overusing or overusing cardiorespiratory fitness and strength training. The degradation of muscles, as well as tendonitis, muscle strains, and stress fractures can also occur with just the overuse of cardiorespiratory fitness and strength training. In addition, it is vitally important to keep a good diet in mind when participating in cardiorespiratory fitness, just because of the fact that with good cardiorespiratory fitness comes a good diet, and if the diet's bad, then the cardiorespiratory fitness will also be bad. Studies, which included 198,271 subjects, concluded that a better diet led to a better cardiorespiratory fitness. This study also determined that a bad diet led to worse cardiorespiratory fitness. A good type of diet that would be good to follow is a Mediterranean diet. This will help you follow the required necessities to keep the CRF or cardiorespiratory fitness trending in a good direction. Another study performed by Jonathan Myers, Paul McCauley, Carl J. Levy, Jean-Pierre Despres, and Ross Arena, and Peter Kokinos is determined that elevated cardiorespiratory fitness leads to an increased risk of obtaining cardiovascular disease.
Cardiorespiratory fitness should be implemented in a balanced fitness routine. First, you should start by assessing your current fitness level. You should set a goal for yourself that is muscle gain, weight loss, or improved endurance. When setting your weekly plan, mixing cardio and strength workouts, you could start with 150 minutes of moderate intensity or 75 minutes of high intensity a week. Your strength sessions should be 2 to 3 sessions a week. For strength training, you should focus on arms, legs, chest, and shoulders. You should start with light weights and have a slow build up throughout your sets. Take time for your body to rest as well. Make sure to set days where you only do cardio. The workout is only part of the cardiorespiratory. You should make sure to eat healthy and drink plenty of water. Remember to warm up before and after your workout. Focus on maintaining good form to prevent injuries.
Poor cardiorespiratory health and low strength are both detrimental to the overall health of a person. Let's start with cardiorespiratory health. When this is poor, our hearts and lungs struggle to supply enough oxygen during even simple activities. Think about how out of breath you feel climbing a few flights of stairs or walking quickly. Now imagine that feeling all the time. This can lead to quick fatigue, impacting productivity and limiting everyday activities. But more importantly, low cardiorespiratory health is linked to serious conditions like heart disease, high blood pressure, and even type 2 diabetes. Even our immune systems suffer, making us more vulnerable to illnesses. Now let's look at muscular strength. Low strength affects balance and stability, increasing the risk of falls, especially as we age. It can also lead to issues like chronic back pain, joint problems, and conditions like osteoporosis. When we don't have enough muscle strength, we become less independent over time. Imagine needing help with tasks you used to do daily, like carrying groceries or even standing up from a chair. This loss of strength can take a toll on mental health too, leading to feeling of frustration or helplessness. When combined, poor cardiorespiratory health and low strength can significantly reduce our quality of life. But here's the good news. By making fitness a priority, whether through cardio strength, training, or both, we can improve our health, increase our independence, and build a foundation for long-term wellness.